Welcome to another episode of Dean Hospital Health Digest. As Dr. Nasir Abdullah, the medical director of Dean Hospital Ihsanlu, discusses an important aspect of diabetes mellitus. Complications of diabetes mellitus. Long-term complications of diabetes develop gradually. The longer you have diabetes, and the less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include 1. Cardiovascular diseases. Narrowing of blood vessels called atherosclerosis predisposes to coronary artery disease with chest pain called angina, heart attack and stroke. Therefore, if you have diabetes, you're more likely to have heart disease or stroke. 2. Kidney damage called diabetic nephropathy. Diabetes can damage the delicate filtering system of the kidneys, which can result in kidney failure or irreversible end-stage kidney disease. Such individuals may require dialysis or a kidney transplant to stay alive. 3. Nerve damage called diabetic neuropathy. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves. In the limbs, this can cause tingling, numbness, burning or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea or constipation. It may lead to erectile dysfunction in men and vaginal dryness in women. 4. Eye damage called diabetic retinopathy. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. Diabetes also increases the risk of other serious vision conditions, such as cataracts and glaucoma. 5. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. Left untreated, cuts and blisters can develop serious infections, which often heal poorly. These infections may ultimately require amputation of toe, foot, or leg for the person to stay alive. 6. Diabetic emergencies. This usually happens when blood sugar is either too high or too low for too long. They are life-threatening conditions that requires immediate medical attention. The diabetic emergencies include a diabetic ketoacidosis, DKA. This occurs when there is no enough insulin to deliver sugar to cells for energy. The body then begins burning fat for energy, resulting in accumulation of ketones, which is poisonous to the body. B. Hyperglycemic hyperosmolar syndrome. This occurs when the blood sugar level becomes extremely high, usually over 600 mg per deciliter, for a long time. C. Hypoglycemia. This refers to a situation in which the blood glucose is too low. It usually occurs as a side effect of the drugs used to treat diabetes, especially insulin. D. Diabetic coma refers to a situation where a person passes out due to extremely low or high blood sugar, is an emergency that requires immediate medical attention. Other less common but important complications include increased bacterial and fungal infections, hearing impairment, dementia, and depression. These are scary, aren't they? Well, there is a good news. You can prevent or manage these complications in 2 ways. 1. Take necessary steps to prevent diabetes. 2. If you are already diabetic, take necessary steps to make sure your blood sugar is well controlled. To learn more about diabetes, including its prevention, check the description below and click on the link to my other videos on the subject. Thanks for watching. Like, subscribe to my channel, and click on the notification so that you can be notified whenever I upload a new video.